From honor student to trauma surgeon, this week we're talking to 2025 USF Outstanding Young Alumni Award recipient, Dr. Bailee Olliff, about her time at USF, the importance of mentorship, and her fascinating medical career. All that and more coming up next. Hey Honors Bulls! Welcome to the Honor Roll Podcast, the flagship podcast of the Judy Genshaft Honors College Podcast Network. I'm your host, Caroline Merriman, a fourth-year student studying English and biology at the University of South Florida and a member of the Honors College. Today, my co-host is Fabiana Requena, a third-year student studying marketing and business analytics.
Hey Caroline, it's great to be on the podcast.
As always, we like to start the podcast off with one big question. So my question this week is, how do you figure out the right balance between chasing your goals and doing meaningful work that helps others?
You know, Caroline, I think that's a great question. And I would say that finding the time to do things like volunteer and use your strengths and your skills to do something that you do really enjoy. So if that's giving back to your community, giving back to the environment, whatever you can do, just finding a little bit of time here and there to contribute to something you really, really care about.
Yeah, I think there's always ways, there's so many opportunities in the community, there's so many opportunities in schools and things like that, where there's always a place to plug in, there's always a place to kind of combine the things you're interested in some way that benefits the community as a whole, whether that's through volunteering or maybe doing something like painting a mural or picking up trash. It can be small things, right? Well, this week, our guest, Dr. Bailee Olliff, is really committed to mentorship and to taking care of her community through medicine. She is a surgeon specializing in acute care robotic surgery and the trauma medical director at HCA Health One Mountain Ridge in Colorado. Stay tuned as Dr. Olliff discusses mentorship, community involvement, and her career in healthcare.
Hey Honors Bowls, my name is Nick and I'm a junior majoring in information technology with a minor in entrepreneurship and innovation. At the Judy Genshaft Honors College, I serve as a student council president and I also work here as a building manager student assistant. My favorite part of being the Honors College student council president is definitely the community impact on the Honors College and USF and Tampa Bay community. For example, I helped to organize the Honors Community Service Day, where we went to 3 different locations in Tampa and St. Pete, offering help with food distribution for homeless people and also walking pets from the shelter. And as always, go Bulls!
All right, joining us now, we have USF Honors alum, Dr. Bailee Olliff. Would you like to introduce yourself?
Yeah, sure. My name is Bailee. I was born and raised in very rural Central Florida and came to USF when I was 18, right out of high school. I actually met my husband in high school and we came to college together. So my high school sweetheart, and majored in biomedical sciences. I did a minor in biomedical physics. And while I was here, was very involved kind of on campus with different organizations, but most of my time I invested in volunteering with a domestic violence awareness organization, and then stayed here for medical school, which was awesome, and then matched here for general surgery. So stayed here for residency as well. That's why they call it You Stay Forever. And then did my fellowship in Rhode Island, and now I live in Denver, Colorado with my husband. And my cat, who has been with me since I was a senior in college, probably. But yeah, I'm a trauma surgeon, but I also specialize in robotic acute care surgery. And probably my biggest passion still is community service. And I make an annual mission trip to Cambodia to do surgery every year. And I'm also the trauma medical director of my hospital, so kind of impacting patient care on a larger scale rather than, one patient at a time, which I still get to do as a physician. But yeah.
Well, it's really great to have you on the podcast. So you were recently recognized with the 2025 USF Outstanding Young Alumni Award. Congratulations.
Thank you.
This award is only given to a few alumni under 35 each year who have made a really big impact on the university in their fields. What did it mean to you to receive the award?
it's crazy to me when I met the other recipients. It's a little bit of imposter syndrome when you meet the other recipients, right? So, someone is an ambassador to Peru and someone has a picture in their, you know, profile with Obama and they work for Meta and Google. And yeah. And I'm like, are you sure? Like, did you guys get the right person? Like, are you sure you got the right thing? So, my first reaction was like, "Are you sure?" But it's crazy, to be and humbling to be honored with people that are so accomplished and have accomplished so much in such a short amount of time. I did just kind of barely slide in the cutoff of under the age of 35, so barely made it for the young alumni award. But yeah, it was very humbling and a wonderful experience to meet everyone.
I'm sure they were starstruck when they met you. I'm sure.
Well, we kind of joked about it last night. We were all kind of like fangirling over each other, which was really cool.
What was it like to come back to USF after so much time away and being in Denver and going to trips to Cambodia?
So today I had a trauma response because I used to have a class in the Bill Young Hall. I had calculus there. And my next class was like 15 minutes later, and it was in the dorms all the way on the other side of campus. It's like Juniper Poplar or something. And I had like 15 minutes to get from there to there and not arrive in a full-blown asthma attack, basically. So the size and the growth is crazy. I got to go to the medical school yesterday and just so much growth and expansion, and even on campus here with the Honors College, and just so much has changed in a good way. And it's what you hope to see when you go back somewhere that you haven't been in a long time, and you see that mission of growth and change and progress is still going on. So it's been awesome.
So you were also an honors student at your time here at USF. Can you tell us a little bit about your honors experience?
Yeah. I think it's really interesting to be around other people that are like you. So college for me was really all about finding, and really, I mean, your journey into medicine is really all about finding people that are like you. Every step of the way, you kind of find these little niches of people and you're like, oh, these people get me. These are my people. And I definitely felt like that with the Honors College. And I'm sure students all over campus feel like that in different things that they're involved in different organizations. But my first class was a philosophy class with Dr. Bishop. And I remember, I came from a very small, rural, conservative town. And so we started debating ethical topics and, hearing all these people from all these different places share their opinions and their different experiences and their different belief systems. It was wonderful to be exposed to all of that so early. And I don't think I would have gotten that without my Honors College experience. And then, some of my favorite classes from undergrad were definitely, I mean, obviously we have to do the chemistry, the biology, right? That stuff. But the classes that stand out the most to me are things like my Honors College class on India, right? Where we all brought in different food and tried it. And we each presented on different topics that were interesting to us. And I did medical tourism at the time. And so it's so interesting to think back. Those are the classes that kind of stand out to you, or those kind of unique experiences, things that weren't necessarily prerequisites, but that's kind of what I always think of.
I agree. I think that's always what people look back fondly on about the Honors College is the unexpected little experiences they had doing cultural classes or food classes, or Fabi's in a you make EDM music in your capstone.
Yeah, I'm in an electronic dance music class.
That's amazing. Probably top 2 favorite class from college was I took swing dancing, and
that's so cool.
I learned so much and I had such a good time, and it was just, do I need to take that, right, to get my degree? No, but it was all about just branching out and new experiences and trying different things, and that was really fun. So,
do you still swing dance?
I don't. I don't. I probably could if I had to, but no, I don't. But it was so much fun. It was great.
So you were deeply involved with the community throughout your academic years and now in your career. Why has community involvement been so central in your life, and what kind of different initiatives are you really drawn to?
So I think growing up in a very small town, a very rural town, early on, I kind of saw what health disparities look like and what it looks like for people who are socioeconomically disadvantaged to be set back in life for experiences and situations that they have no control over, right? And so I knew right away that I wanted to go into a career where I could help people that had similar experiences to myself growing up. Um, and then, in medicine, I knew I loved surgery, but trauma surgery specifically, you're often encountering patients who are in those situations. And especially where I work in kind of a metropolitan area, a lot of gang violence, a lot of gun violence, things like that. And so a lot of times, the only time a person interacts with a healthcare professional, maybe ever in their life, might just be the one time that they see me. And so it's really an opportunity to give back to people in those communities and try to make a positive impact on them and their health, even for the brief period of time that you see them. I think, that kind of started with some of my community service experience in college and in med school. But it definitely led me to a career path where I felt like um, there were things that I could do, especially in a position of trauma medical direction, to actually contribute to injury prevention in those communities. There's not a lot of jobs where you try to decrease the amount of business that's coming
Mhm.
into you, right? But our goal is actually to prevent injuries before they ever occur.
Mhm.
So a lot of what I get to do now is working at that level, a much higher level of trying to get education out into the community and try to actually prevent harm. And so that's kind of my way of staying active with that.
Mhm.
Obviously, my mission trip to Cambodia every year is awesome. Um, I think you get a sense of gratitude and humility from those community service experiences, especially when you go experience healthcare in another country, that you can't really get perspective on here. Um, and that just changes your gratitude for how you practice and work every day. So,
I think it's really interesting that you have this passion for medicine that supersedes just the idea of doing medicine, right? Like it's a humanitarian approach. It's about more than just like, can I help this person's body, right? It's a more systematic approach to like what is
yeah.
wrong in our healthcare system and our socioeconomic system. How do you think this approach to medicine, one, just is better for the world, but also like, do you think it provides you with some source of like longevity in your career?
Yeah, definitely. I think those times where you experience burnout and the things that cause me frustration in my medical career, it's not patients. It's not, work hours. It's not, the people that I work with. All of those things are great. It's the system barriers that I face. It's the frustration of trying to get someone care who doesn't have health insurance. It's the frustration of trying to get someone, authorization for a procedure that I think they need, and someone else who doesn't necessarily agree with me gets to make that decision for them and say no. That can be really frustrating. And so the best way for me to avoid burnout and the thing that kind of refills my cup is that community service. It definitely, things like my mission trip and things like injury prevention in the community, definitely helps kind of refill me and restore me and prevent those feelings of burnout for sure.
So you're really involved in the community, and likewise, you're also involved in a lot of leadership roles, especially at the Morsani College of Medicine. You founded the Plexus Mentoring Program,
Yeah.
and you're working as a patient coordinator for Bridge Clinic. How do you think those experiences really translated into becoming a medical director now?
Yeah. Bridge Clinic is amazing, and it's been wildly successful and still functions today very well and has provided so much healthcare to people who need it. And that was the first time I really got to experience, instead of trying to fix a problem in healthcare one patient at a time, which can be exhausting and can cause burnout for people. Looking at a system and saying, hey, this doesn't quite work super well in our clinic. What could we change about this process? What could we make better so that our patients are more comfortable or something's easier for them to get the care they need? So that's kind of the first time I looked at, when I first hear the word administrator or something like that, I'm like, oh, that's not me for sure. But it was like if you take on some of those leadership roles in those settings, you get to have a say and you get to have an impact on how things are for your patients. And that's kind of where I first learned that principle. Plexus also is still going on today and doing very well. And I had some wonderful colleagues in medical school that worked with me to create that. I did not do that alone. And that is the whole purpose of the organization, right? Is that no one should have to go through their journey into medicine alone. You should be connected with people who are going through it, who have gone through it, who can mentor you and provide advice. And that's the way that you are successful in healthcare too. No one does anything by themselves in healthcare. Every morning at 8:30 a.m., I round with a pharmacist, a case manager, a social worker, a charge nurse, the nurse of my patient. I mean, the list goes on, a physical therapist, an occupational therapist, a speech therapist. And so kind of instilling those principles in students early on, to reach out for help when you need it, find someone who's the expert, ask them how to do it. It sets them up for success in the future. No one should have to go through this journey alone. And then when you get to that point in your career where you're actually taking care of patients, you don't do that alone either. It's a huge combined effort, and it really does take a village to do that.
As someone who's not only serving as like a higher up in a hospital, which I'm sure like in that way, like education has its own utility, but as someone who's also like seen, medical school from the ground up, what is the importance inside medical school, but also in the community of like having some kind of like pathway to educating each other, whether that's people that are younger than you or just community members or coworkers?
Yeah. Education in medicine is non-negotiable. So the moment you decide to join the field, you are agreeing to become an educator, because every part of your journey along the way, you will have someone that will educate you and someone you can educate. And every workday that you have, someone around you will need your education and can teach you something in return. So, interestingly, kind of growing up, I always thought I wanted to be a teacher. That's actually what I really thought I first wanted to do. Of course, until I saw all the, cool stuff in the hospital and technology and, anatomy and all that stuff. But when I found out how integral teaching was to medicine, I was like, oh, this is my calling, because it's part of the job. And so you sign up to educate others in residency, you sign up to educate medical students while you're in residency, and it's a lifelong journey. Even if you're in private practice, even if you're not in an academic situation at all, there's still EMTs, paramedics, nurses around you every day who are going to be relying on you for your education and teaching. And so maintaining an open and positive outlook on teaching is very important.
Here at the Honors College, I feel like we have a lot of students on the pre-med track.
Mhm.
So could you talk a little bit about being a trauma surgeon and what a typical day-to-day looks like? I know you mentioned you
Yeah.
have a lot of rounds in the morning, but would you
Yeah.
mind sharing?
Yeah, for sure. It's a little bit like it's a little bit similar to the experience of first responders, in the sense that you work pretty long shift work hours typically. I mean, that can vary in different practice settings, but I typically work 24-hour shifts, so 7 a.m. to 7 a.m. And you kind of, similar to firefighters and paramedics, you kind of wait for the action to happen. So, you might go a full 24 hours and nothing really crazy happens. You might go 24 hours and do 7 surgeries and take care of 30 patients. There might be, unfortunately, it has happened to me a few times, a mass casualty incident while you're on call. And you stay in the hospital for 36 hours or longer to make sure that everybody's kind of tucked away and stable. So my typical day, I start at 7. I try to get all my rounding done by 9 a.m. because then it's kind of like everyone's awake and they're on the road and anything could happen. But typically I have a few surgeries a day. I do trauma surgery and I also do acute care surgeries, things like appendicitis, gallbladders. Those things are kind of always coming in the door all the time. So those are kind of factored into our daily workload. And then trauma is just unpredictable. I mean, when the weather's warm out and everyone is ready to be active and outside again, is definitely a higher incidence of trauma because we're all in our cars and on boats and doing that kind of thing. In Colorado, winter is just as bad because we're all skiing. So it's kind of an unpredictable thing, but that's actually part of what I really like about my job. It's not predictable. I'm sure that would drive some people very crazy, but it's different every day. There's not a something that I could read every morning to be prepared to go to work. I might do a case that I've never seen before or have never performed myself before. And that's kind of, part of the training experience is making sure you're ready for those things.
Yeah, I'm sure with the idea when people hear, "Oh, I'm a trauma surgeon," they're like, "Oh, why would you?" That sounds scary, right?
Yeah.
What drew you to trauma surgery in the first place?
Yeah, I think for me, surgery in general, I think most surgeons can relate to this, is very much when I see a problem, I want to fix it, and then it's better. I have the utmost respect for my good friends and colleagues who are in other fields who try something and have to wait and check labs and see if it worked and then try something else. I am an impatient person and I can't do that. So there's definitely that aspect that's sort of you see a problem, you fix it physically, and it's better. And then with trauma specifically, a lot of it for me has to do with the population that I get to work with. I have a pretty large population of geriatric patients that I get to take care of, and who are able to share life experiences and are not given the credit they deserve with regard to their wittiness and humor and sharpness and activity. There's so many 90-year-olds that I've taken care of this year who are living independently, driving, taking care of themselves, and we discharge them home to do the same thing again. So, and then, my population that's at risk for gang violence, penetrating trauma, that sort of thing, that kind of goes back to what I was saying before, where it's probably the only experience they're going to have with healthcare, and we want to make it a meaningful one, and we want to hopefully have an impact on them to maybe be able to change their circumstances or at least provide them with a skill set so that they feel safer going out into their community again.
Explore the world of research with the University of South Florida Undergraduate Research Portal. This centralized online portal paves the way to exciting research opportunities filled with discovery and personal growth. It will connect you with the right research lab, professors, and mentor relationships at USF. The perfect research opportunity is just one click away. Search USF Research Portal or visit the Judy Genshaft Honors College website to learn more.
When you were first interested in medicine, did you realize how much that not only that bedside manner would matter, but that it impacts a person outside of just their immediate physical condition, right? There's more to it than that.
Yes, for sure. I think surgeons definitely have a bad rap for bedside manner.
Yeah, they do.
If you watch television, every surgeon on TV has got this, chip on their shoulder kind of thing. But I think for me, it's one of the most intimate experiences you can have with another human is for them to be completely asleep, completely vulnerable, and have absolutely no control over what's going on. And you are truly holding their life in your hands. I think it's really important to consider that every time you meet a patient, even if it's for something as routine as appendicitis. My residents know, I'm super big on every patient before they go even over to the pre-op area. For me, if they're coming from the ER, we have to talk face to face. We have to sit down. We have to go through all the risk and benefits of their surgery. Even if it's an emergency situation, I need them to know what my face looks like before they go to sleep. And so I think that's really important. And it's also really important for physicians to remember, taking out someone's gallbladder for me is just a Monday, right? But for them, it might be the biggest surgery they've ever had in their life or the biggest thing they've ever gone through in their life. And so sometimes we can be dismissive of people because for us, it's such a routine thing, right? But I recently had the privilege and absolute terror of operating on one of my best friends. And, for him, he is so healthy and he takes such excellent care of himself. And for him to have a surgical problem like that and to never have had surgery before is such a huge deal. And so it's such a huge responsibility to take care of people in that situation. And I think for that reason, it's really important to just stop, remember your humanism, take time at the bedside, and really connect with people.
So, Dr. Olliff, with the field of medicine, oftentimes the work, like you're saying, you're working 24-hour shifts, it can lead to a lot of stress and oftentimes burnout. How do you balance your work and your life, and why is it important to pay attention to it?
Yeah, I think one thing is surrounding yourself with the right team, both at work and at home. So at work, I have a huge team of people that supports me. Again, it's not just me running this program by myself. I have, my trauma administrative team that works over in the office that helps me scrutinize patients' charts and look for issues and how we can fix things and make them better. I have specially trained trauma nurses that help me every day that focus on just taking care of trauma patients. I have PAs that are lifesavers, best friends. Please don't ever leave me. People I couldn't live without. And so at work, like I said, the burnout comes from frustrations with the system and the setup and access to healthcare issues that my patients have. I don't find that I have burnout from other things because my team is so great and so supportive. And if we do go through something bad, we talk about it together. We debrief about it. We have a very open dialogue. If we disagree on something in the moment, we go back to it later. We talk about it. And then at home too, right? So surrounding yourself with good friends, a supportive partner, and making sure that in your time off, you invest in yourself, whatever that means for you. For me, it's skiing, not incredibly well and not incredibly impressively, but it's skiing. It's making fresh flower arrangements for my house. It's, going to farmers markets with my friends and being outside and being active. So whatever that means for you to take care of yourself in your downtime, I think it's really important. And you can't neglect that. And you have to make sure that that personal time is set aside and that it stays protected. You have to master, do not disturb.
Yeah.
I am out of the office. I have set an automatic reply. That is super important. It's not something you realize until later on how precious your personal time is with your friends and family. So that's one of the things I do. My phone is on Do Not Disturb right now. I'm sorry, everyone. But I mean, I got 3 work calls on the way here. So it's something you really have to be very protective of your personal time.
Yeah, I think when people go straight from undergrad to grad school to starting a career, that it's really easy to forget what normal looks like after it's I've had to sacrifice all of my fun time or my downtime to get to this point. Then how do I get back to
And
living
you
a
have to
balanced
carve
life?
it out, right? I mean, you have to say, okay, every year when I go to Cambodia, I'm going to tack on another country to visit and go experience somewhere else and take that time for me and my partner to just explore the world together, right? You have to carve it out. You have to make time for yourself. It's super important.
Yeah. Another thing I wanted to kind of touch back on was you've talked a few times about healthcare disparities and working against the system and how that shows up in your work. What can be done not only from the healthcare perspective, but just as a society, as an individual level to make things more accessible, make our healthcare system more fair and more equitable?
We would need a dissertation for that, probably on the podcast. I think probably the most important thing that we can all do is be well educated on the issues and vote for sure. And make sure that your vote is counting and that the people that you're putting in place to make healthcare policies are people that are also well educated on the issues and are making decisions that you're okay with affecting your children, because everything we decide on right now is going to affect our children and the next generation of people, right? Um, so I think voting is probably the most important thing. And then I think also, you know, being healthy and taking care of yourself. Like I mentioned, my friend that I just unfortunately had to do surgery on, he takes such excellent care of himself. It's been a week. He's great. He asked me, when can I go back to work? He's at home. He's not in the hospital. He's eating. He's drinking. He's active again, right? So that's something we have control over, right? A lot of times it can be very frustrating when you feel like, I don't have control over this crazy system that's going on or these crazy issues. We have control over our own health. And so making sure that we're healthy and that we're taking good care of ourselves and our families can definitely set us up to feel a little less vulnerable to the system, for sure. But for what you can do for other people, I think definitely voting and finding causes to get involved in that, things like Bridge Clinic or things like the organization I work with, To Go Abroad. I mean, places that you trust and you can verify that if you're getting involved with them or you're making donations to them, they're doing the right thing with it. So
I think this also has a lot to do with doing research, and you've actually been
yes.
involved on a lot of academic papers and poster presentations. What motivates you to do medical research?
So now my research interests have shifted quite a bit. I really, where my research interests are now, what my team works on now is looking at our own kind of internal functioning and how it compares to the rest of the country and if we're doing a good job or how things affect us. A really good example is we just had a national IV fluid shortage. I don't even know if the general public realizes that,
No.
but we were on a national IV fluid shortage for almost 6 months, I think. We didn't have an adequate supply of IV fluid shortages because of one of the hurricanes that damaged the main production facility in North Carolina. And so we were very afraid that if we didn't have the right amount of fluids, that our patients could be affected by that, obviously. Are they going to be more dehydrated? Are they going to have more problems with their kidneys? Are they going to have more problems with their muscles? Things like that. So my team looked at our fluid utilization during that time and actually found that we didn't have that problem and that we probably should have been using less fluid to begin with. And we probably could be more judicious with that fluid anyway. So sometimes that's what I like to do. My point is I like to find research projects for myself that are going to directly impact the way a physician practices. I am not a passionate person about basic science research. There are so many of them. I'm so grateful for them. They are my friends. They're wonderful. They're geniuses. But for me, my passion with research lies in what can I look at that's going to directly affect how I'm practicing medicine on a day-to-day basis. And that's really the type of stuff that interests me.
I love like the practical application of it. I don't think it's like when you hear research, it's necessarily exactly what you think of in medical research. Like we're
Right.
thinking CRISPR and
Yeah.
all of those things.
Yeah. And it all trickles down from, basic research becomes therapy, becomes drugs, becomes treatment. And then people like me get to look at, okay, well, if I put someone on this or this, how do they do? Do they do better? Do they do worse? And then it keeps breaking down. And there's so much you can explore. But I think, I really enjoy the practical application, clinical application type research.
As we look towards the future, what do you hope for your career? What do you hope to do in the future and personally?
Right now, probably my biggest passion project is I do robotic acute care surgery and I train other surgeons to use the robot. So I'd really like to see some expansion in that space when we look at what we call acute care surgery or emergency general surgery. A lot of times, traditionally, we've done those surgeries open with very large incisions for people. And I'm trying to contribute to and spread the word that we can do those things with tiny incisions and cameras and things like that. So that's really kind of where my growth trajectory right now, it's kind of where I'm focusing my energy, I guess I would say. But I always say that no matter where I'm at in 5 years, 10 years, I always want to be where I'm needed. So if that's my current job that I have now and my current position that I have now, I'm still needed there in 10 years, then that's exactly where I'll be. But if I'm not, if there's someone better to do the job, if there's someone that comes along who's passionate, who wants to step up and step into a leadership role, and I'm needed somewhere else, then that's where I'll go. I think you should always go somewhere where you're needed and be somewhere where you're needed. And if you're not, it should definitely give you some pause for reflection.
Absolutely. Yeah. Could you talk a little bit about doing like robotic surgeries and like the importance of that, what that's been like for you?
Yeah. So traditionally in surgery, we have 3 approaches. So either traditional open surgery, large cuts, laparoscopic surgery, which is tiny incisions and a camera, and you stand at the bedside and do that. And then with robotic surgery, we use tiny incisions and a camera, but we use a device that stays over the patient and the surgeon operates on a console. For me, it has been instrumental in challenging myself to know that with this platform and, with the skill set that I have, that I can do bigger surgeries and keep them minimally invasive for patients. It's less time in the hospital. It's less pain. It's less risk of infections, things like that. And so, my 2 fields are very dichotomous. Trauma surgery is maximally invasive surgery. You don't get the incisions are huge. What we do is huge, right? And then on the other end of the spectrum, I'm like, let's try to do the tiniest incisions we possibly can, right, for this problem. But maybe I'm trying to just balance out my, approaches. But yeah, it's really been instrumental for me in pushing myself and pushing the boundaries of what we can do minimally invasively.
Is this like a technology that like is more applicable to like scheduled surgeries types of things, or is it like something you see aiding in like the future of trauma care?
So that's kind of what we're pushing right now is definitely for scheduled surgeries, definitely being able to at my facility, we provide 24/7 emergency general surgery on the robot. So whether you come in at 2 p.m. or 2 a.m., you're going to get the same surgery with the same tiny incisions and a camera, if we can safely do it that way, obviously. And that's our goal, is that any time of day for any surgery that we're able to attempt to do that. That probably won't always have an application in trauma. It's just not the same, same thing that you're addressing, or I should say, it's not the same problems that you're looking at. But I think it has broader applications when it comes to surgeons educating each other and sharing their experiences, being able to be in a surgery, call in another surgeon on a screen to show them what you're doing and ask them for assistance or help or what they would suggest in that situation, rather than someone flying across the country to be in the operating room to help. They can literally look at what you're doing, make suggestions, see the setup of your instruments and help kind of guide you through that process. And that's where I think the potential is pretty huge. Obviously, we have to make sure that patients are comfortable with that type of thing and that they're well informed on that, and they are. But potentially applications being able to actually perform a surgery at some point in a remote location, maybe a place that doesn't have access to minimally invasive surgery or things like that. So that's kind of a huge, pie in the sky picture of what it could be. But I think for me, it's been tremendously helpful to be able to reach out to other surgeons in the robotic surgery community and get that guidance from them.
Well, thank you so much for joining us today. We want to ask you one last question just for all the honor students who may be listening.
Yeah.
What advice would you offer to honor students or just like anyone in general who's like looking to pursue a career in, healthcare of some sort?
Yeah. Someone asked me yesterday something very similar. I always say the same thing. You have to take chemistry. You have to take biology. You have to take biochem, right? You have to take the MCAT. You have to get letters of recommendation, all that stuff. I don't need to give you advice about that. You already know. If you want to pursue a career in healthcare, you already know all that stuff. But it's really important along the way to live your life, because the whole point of going into medicine and the whole reason why we do medicine is life is short and you don't know when it's going to change. So take the class on India, take the swing dancing class, take EDM, I guess is now probably a lot cooler, but take the time to take those fun classes, take your summer and travel, spend time with your friends, go to the football game. You know, obviously you have to do well in school. You have to take care of those things. But my advice is always to stop, enjoy the journey. Yeah, because you can't get those moments back. Even just driving on campus today, I saw people just like laying out at the pool, and I was like, that's so awesome. Like, just enjoy your experience along the way. You're going to meet people. You're going to see things that are going to make you a good human. And you can't be a good doctor unless you're a good human. So make sure that you're enjoying that journey along the way and doing everything. Say yes to everything. Take every opportunity. Explore, travel. And the rest of it will work itself out. Yeah.
Well, thank you so much for that advice. I'm sure it'll really help a lot of our students to hear that. And that is all the time we have today. Thank you so much for just sharing your experience in medicine and for joining us today.
Of course. Thank you so much for having me.
All right, Caroline, we're back in the studio. I think that was an amazing podcast. What'd you think?
I think what I really enjoyed about the podcast was just seeing how passionate Dr. Olliff is about making medicine like more equitable, more accessible for people. I don't think it's the first thing you think about when you think about medicine is someone like doing community-based work, but it was cool to hear about how she's been working with people in her area.
I definitely agree. And I think that also the way that she gives back to the community through mentorship and here at USF, like founding those programs to help students that are currently on their path to become part of the medical field. I think that's something really invaluable. And mentorship, I feel like you learn the most from that, really, because it really gives you that hands-on and you can learn from somebody that already went through the same things you did.
And if you're looking to get more connected with our community here at USF, maybe to volunteer or to take part in opportunities like Dr. Olliff did, don't forget to check the Honor Roll newsletter and our website at usf.edu/honors for all upcoming events, updates, and news. That will do it for this week's episode. The Honor Roll podcast was recorded in the Judy Genshaft Honors College at the University of South Florida Tampa campus. Production assistance is provided by honor student Sandra Napolitano. Thank you all so much for listening, and please do not forget to rate and review our podcast. We appreciate your feedback. Please join us next week to hear about what we're up to at the Judy Genshaft Honors College.
Until next time, go Bulls!